So welcome to another edition of Open for Business. Today's guest is Nurse Karen Balerna up in Hilton Head area. And first of all, I want to congratulate you on being a Biz Pitch winner last month.
Thank you. Thank you for having me.
Yeah. So tell us what the Biz Pitch was about and your business, which made you a winner.
So the Biz Pitch was, this was the first annual Biz Pitch contest that they had. And they sort of equated it to a Shark Tank where you talk about your business, where you're at with it, what you need help with. And it was part of the Thrive Women's Conference on Hilton Head.
Excellent. So your business, tell us your concept with your business that won this contest.
So my business is Nurse Advocate Partners, and we are all registered nurses who accompany clients to their doctor's appointments to make sure that they're understanding what the doctor's telling them, make sure the doctor's understanding what's going on with them at home, make sure their questions get answered. And then once they go home, we make sure that they understand what they're supposed to be doing at home. Many times people forget information that's given to them, even if they understand it at the time they're at the doctor, by the time they get home. A lot of that information has been forgotten. So we keep reinforcing the information that they've received.
That's a huge niche. That is, that's something that is needed across the country. How did you get into that? What's your story for how you got into this?
So it all sort of, I actually didn't know what I was getting into. I didn't know what it was called. I just knew that it was needed from a personal story, actually, with my dad. He had gotten sick and was being pressured to have a procedure done that I didn't think was appropriate for his level of health and his age. So I ended up getting a second opinion and finding a less invasive way to solve the problem that he was having. But it just made me think, well, what do people do if they don't have a nurse in the family that will question things like that? My father's generation was, the doctor says I need to have this done, I need to have it done. And he would have had it done if I wasn't there. The doctor actually went in and talked to him, and my father agreed to the procedure, but he didn't realize that there were other options. So it kind of became our mission to make sure that people have all the information that they need to actually make their own informed decision as to what's appropriate for them and their family.
Well, how perfect a registered nurse in on those conversations that you can really make very educated decisions on which direction to go.
Right. A lot of people think, oh, I do that for my husband or I do that for my wife, but they don't have the medical background. So they don't know what to question. They don't know what seems appropriate or where to look for another option if it doesn't really seem appropriate. So I think it's important to have a medical background.
Oh, absolutely. And give us 10 things that we should know about healthcare. And this is really important. And I think we need to go through all these 10 things because people need your kind of services.
Yes, I agree. So one thing that I realized, I've started my business actually up in Massachusetts. I forgot to mention that. So I've been in business for almost 7 years. Up there, and then when I moved down here, I opened the business down here. And one of the things that I discovered here is that it's hard to find specialists. So a lot of people will go to, their primary care physician might be at Hilton Head Hospital, but they might not be able to get into a specialist there. So they may go to a Buford Memorial doctor. And then these computer systems don't talk to each other. So one doctor doesn't know what another doctor is doing, and they don't pick up the phone and call each other either. So it's really up to the patient to have all that information and relay that to the doctors, because one doctor might prescribe a medication and the other doctor doesn't know it was prescribed, and they might prescribe a similar medication that really shouldn't be taken together. So
that's crucial.
Yeah, so we're that kind of consistent person that goes with them to all their appointments and has all that information and know what's important to relay to each doctor.
Right. Okay, that's a really good reason to have a nurse advocate at all your appointments.
For sure. And then, in this day and age, the doctors are spending less and less time. They're restricted with insurance companies. They need to see a certain number of patients a day. And the average amount of time that a physician spends with their patient is 13 to 16 minutes. So you really need to make the most of that time. And many times I've had clients that, we let them guide the appointment and we let them talk and try and bring up the questions that they have themselves. But if they don't bring them up, or they're too busy talking about the last trip the doctor took, or how are your kids, it's a social outing for a lot of people. So we're kind of the one that before the doctor runs out of the office, we make sure that the questions that they have or their family has gets answered. Or if something really wasn't clear, and I can tell sometimes by looking at a client that they don't quite understand, so I'll ask them to kind of repeat it in a different way. Or sometimes it's better just to, as long as I understand what they're saying, sometimes it's better to reiterate it, outside the office on the way home or back at their home. So
it's a great reason.
Sure.
So what else?
So one of the biggest issues that clients have down here is getting to doctor's appointments. It's a $150 billion annual loss in the healthcare industry that either people are forgetting appointments or they can't get there. So we provide transportation to appointments. We give them reminder phone calls the day before to make sure that they know that they have an appointment, and that way they're not missing appointments. When a doctor has a missed appointment, they not only lose money for that appointment, but now they have to rebook that other patient. And so they're taking up another slot there. So it's kind of a double whammy when an appointment gets missed.
And sometimes they charge the patient, right?
They do sometimes, yes.
Yeah. So.
And then another thing is to just know that you can, a doctor can suggest something to you and you can weigh the risks and benefits and kind of decide whether it seems appropriate for you or your family member. It's kind of on the same idea of how I got started is, you don't have to necessarily do exactly what the doctor's saying. If you're on a medication that's making you feel horrible, right, and not really helping the problem, some people will just continue to take that medication, but it's really ruining your quality of life. And so you kind of have to weigh your risks and benefits to decide whether, something like a blood pressure medication is very important to take. But there may be another medication that's not going to make you feel so horrible. So we'll contact the doctor if somebody's having an issue with a certain medication, or, sometimes it's just certain medications just aren't worth taking if they're going to make you feel more sick than you did before taking it.
Excellent. Okay.
And then one thing I think a lot of people don't know is preventable medical errors is the third leading cause of death in the United States, which is just astounding. Whether it's the wrong medication that somebody was given, or a procedure that had an error, or infection is a huge thing too, and a lot of infections can be preventable. So just for people to just make sure people are washing their hands or using hand sanitizer when they come in your room and when you're in the hospital. Make sure that somebody's looking at your armband before they give you medication. Ask what the medication is, what it does, just be informed about what's going on.
Great tips. Absolutely. I've often heard you do not want to be in the ICU without an advocate.
Yes, yes.
And just to have an RN or somebody with a medical background it could be life-saving.
Right. I mean, people are human and people make mistakes, and, nurses in the hospital, not that I'm saying it's all nurses, but nurses in the hospital are very, people are sicker in the hospital, there are people living longer. So there's a lot of stress and they're taking care of a lot of patients sometimes. So it's possible for them to get their patients confused. So it's just very important to make sure that you're getting medication that's appropriate for you.
Absolutely. So what else do we all need to know as we all get
Well, I find a lot of people tend to go to Dr. Google to see what's going on. And that that it can be okay to do some research. You just need to know the appropriate websites to go to. You can't believe everything that you read. A lot of people think it's on the internet, it must be true. And I've had clients say that to me, like, oh, I just read such and such. And I'll be like, well, that you need to make sure you're at a credible website. So I will look things up and send them links. And the websites that I like to use for patient teaching is the best ones are like hospital patient websites, because they talk about different diseases and what the symptoms are, what the treatment plans are, like Mayo Clinic or the Cleveland Clinic, things like that. Those are the best places to go, because a lot of the, if you type in a question, a lot of them will send you to like a blog or like a community forum where people are just giving their opinions on things. And
so Karen, are you seeing just seriously ill people, or are you seeing everybody or anybody who needs assistance?
Anybody that needs assistance. I just find as people get older, they're seeing multiple doctors. So, most of our clients are at home or in an assisted living place. They just need a second set of ears and somebody that knows what the doctors are talking about. Sometimes they don't talk low enough, at a, they talk medical terms. And so and they don't realize that the patient doesn't understand what they're saying. So sometimes you have to just bring it down a level.
It should almost be required that you have a nurse or another healthcare professional, come in on these meetings.
Right. And it doesn't even have to be somebody who's old necessarily. I've had people who, got a new cancer diagnosis, and that's just so overwhelming in itself, just getting that news, that things tend to go in one ear and out the other because you're just so overwhelmed. Mm-hmm. So some people will have me come in and just be there to hear and take notes on what's going on so that they have something to refer to when they go home. Even my husband, he was in his 40s and needed spine surgery. And as soon as the doctor said spine surgery, he wasn't expecting that. And he didn't hear a word the doctor said. I was up in Massachusetts at the time, and he was down here. And I was asking him questions about the procedure, and he couldn't even answer me. I had to have he had the doctor call me so that he could answer all my questions. But sometimes you just get, you get news that you're not expecting, and you just shut down.
Absolutely. So these are great. We all need to hear all of these to keep healthy.
Sure. Yes. And, at any age, whether you're talking about your child or yourself or, any age group, these can be helpful tips. Research has shown that people only remember about 50 to 80% of what the doctors tell them when they're in an appointment. So there's a huge amount of information that either doesn't get heard or gets misunderstood or gets heard wrong or remembered wrong. Right. A lot of people think they're remembering the topics that were discussed, but they miscommunicated or misunderstood what the doctor was telling them. So another important thing is a lot of, the doctor asks what medications you're on, and a lot of people don't understand that vitamins and herbal supplements are also very important to let your doctor know that you're on anything over the counter, because there's so many interactions, or like some herbal treatments have blood thinning components to them. So, if you're going to have surgery or if you're already on a blood thinner, that's important to make sure your doctor knows about that, because a lot of people don't think of them as medications, but it could cause some issues if you go to have surgery and you've been on an herbal supplement that can be a blood thinner. So,
like, what would that be?
Oh, yeah, to put me on the spot.
Type of story about that.
Well, I actually had a client that I had just started with, and she was planning to have a hip replacement. And I went and looked up she was on a bunch of herbal supplements. And I can't remember specifically which one, but one of them was a blood thinner type thing. So she had to stop taking that 2 weeks prior to her her surgery appointment. So
that is really something people don't know.
Yeah. Exactly. So, and then another thing that I'm a big proponent of is to have an advance directive. 2/3 of adults do not have an advance directive or a living will, so that people know what what your wishes are if something were to happen.
What do you recommend? I mean, you've been in this industry for so long. I mean,
and it's another thing, no matter what age you are, once my kids turned 18, I had them fill out a advanced directive so that, and even with HIPAA, I can't get any information on my own child once they turn 18 without them signing a form. So there is South Carolina, if you just Google advanced directives in South Carolina or whatever state, every state has a different form. But you can just Google that and print up your own form. You don't need an attorney necessarily to do it. If you're going to have a will done, they can do one for you. But if somebody says, oh, we're going to get that done in a couple of months, I encourage them to do the print one up at least, if they're planning on seeing their attorney in a couple of months. But for the time being, because you never know when it's going to happen. Right. So for the time being, I think it's important to do it sooner rather than later, and to actually you pick a proxy person to make those decisions for you. But so many people don't actually have the discussions of what their wishes are. So there's no point in having a proxy.
What would those be specifically?
So for me personally, I wouldn't want to be kept alive if I had I was so brain damaged that I wouldn't recover from that. Right. So I wouldn't want, to be kept alive on a ventilator or had a feeding tube put in if I was going to be in vegetative state, things like that. So my husband, who's my proxy, knows that those are my wishes. Or as people get older, they may not want, if you're 95 years old and you've lived a great life, you probably don't want somebody pounding on your chest if you go into a cardiac arrest. So in order to make sure that those wishes are carried out, people need to know that that's what you want done. Because sometimes, a lot of times, I'll even encourage a husband and wife not to be each other's unless they really think that they can carry it out. Because it's hard when they say, we either do this or your husband's going to die. Sometimes it's hard for somebody to be like, well, he doesn't want anything done, but so they want to, sometimes the wife wants to do everything, even though that's not really what the husband's wishes were. So sometimes I encourage them to have their kids rather than their spouse as a healthcare proxy. But it's so important.
Gosh, yes. And you got one last one.
I do. And actually, it came to me yesterday when I was at an appointment with a client, because the doctor that we were seeing actually gave me this last tip. He was telling us that on any given day, certain surgeons could go one way or another on performing a certain surgery. Obviously, there are some life-saving surgeries that need to be done, but sometimes there are surgeries that surgeons do that aren't medically necessary. Like there are some medical treatments that you could try prior to doing the surgery, to see if they will work. So I've learned now that you need to say, is this medically necessary? Is there an alternative to this if surgery doesn't seem to be in your best interest at this point in time? So I thought that was kind of interesting.
Yes.
In a scary way.
I'm so impressed with your progression. I mean, this is actually your second location for this business, right?
It is. Yes. Yeah. So I have
the two companies, or is it?
Yeah. Right. So we are, we're all registered nurses. And so I have some nurses up in Massachusetts that are working for me up there. And then I have some nurses down here as well. So.
Are you always looking for nurses? Are you always looking, how do you recruit them? Do they find you?
Some find me. Some people have either seen, an ad in the Senior Blue Book or have read a press release or something, or some people have approached me after winning the biz pitch and just say it's a great concept and I would love to work with you.
Absolutely. You don't need to get into specifics, but how do you charge? Is it by a package or is it by the hour?
It's an hourly rate, but I have people pay for 10 hours up front and just kind of deduct from there. I find that to be easiest because you never know how long an appointment's going to last. And we start charging when we arrive at the client's house, so they're not paying for any kind of commuting time. And then, we take them to their appointment and we stop charging when we return them back home again.
So are there any other services that you do that you might not have mentioned here with being an
So some clients, so it depends on what the client's needs are, and we try and tailor our services to that. Some clients, in addition to accompanying them to doctors, they need prescriptions picked up, or they need medication boxes filled, things like that. We do a lot of our clients down here don't have families nearby or don't have families at all. So there's a lot of support involved. So sometimes it's just they need to talk through something. So we'll meet with them and talk through some issues that they're having. I think that we try and help keep patients out of the hospital by making sure that they're doing their follow-up appointments and doing what they're supposed to be doing at home. Because the hospital is the worst place for an elderly person to be with infections and everything else. So our goal is to keep them home for as long as possible.
Excellent. So if somebody is interested in your services or they want to learn more, how can they get in touch with you?
So the best place is to go to our website, which is nurseadvocatepartners.com. And all the information is there. There's a contact form, and my phone number is on there too, so they can contact me directly if they have some questions.
So Karen, I want to congratulate you again for winning this big competition. It is such a needed service in this area and really all over the country. I see big things for you.
Thank you.
So thank you for being on Open for Business.
Thank you for having me.